can go ahead.
Hello, everybody. Welcome to June Board of Health. We're going to go ahead. I'm going to go ahead and get the meeting called to order. We do have quorum. I think the one question I just want to ask before we get started is whether there's anybody who has to hop off early that I need to be aware of so I don't lose quorum. Okay, great. So Frank, do we have anyone for privilege of the floor?
No, not that I'm aware of.
Okay, so let's go ahead and move on to the approval of the minutes. We have 3 months of minutes to approve. So I'm going to start with the March 22nd minutes for the first vote up. So if we could get somebody to put a motion on the floor to, okay, we've got a first from Sue to approve as written. I've got a second from Samara. Okay, any discussion on these or edits that are needed? Okay, all in favor is written. 1, 2, 3. Oh, and we've got David. Okay, great. So that is 5, I believe. Melissa, do you want to weigh in? Can you come off and weigh in?
I wasn't at that meeting, I don't think, so I don't think I should weigh in.
Then?
Yes, please.
Okay, well, abstain. And any objections? I think that's everybody. Okay, great. So let's go to the April 26th meeting. We'll need a motion to approve as written. First from Sue. Second from Melissa. Any discussion or edits on these? Okay, all in favor?
I have my hand up. My video's not working.
Okay, great. Thanks, Shauna. I think that's unanimous, but just in case I missed anybody, anybody again, or any objections?
I think I was abstaining because I wasn't at that meeting.
Who's abstaining? I can't. Oh, there you go. I'm sorry. There's so many of you. Thanks. Okay, we have one abstention from Ed. Okay. And then our last one, which is May 24th, we'll need a motion to approve as written. First from Ed. Second from Samara. Any discussion or edits needed on these? Okay, all in favor?
It's Melissa, I'll abstain again.
Okay. So we have everyone in favor. Shauna, what was your vote?
Voting yes.
Okay, a vote for yes for Shauna. Any objections?
I have to abstain because I wasn't there.
Okay, so no objections, and we have an abstention from Sue and Melissa. Okay, great. Let's go ahead with the financial summary, Brenda.
Christina, sorry, can I just interrupt? So I'm logged in actually as my wife. So Katie Kingra is actually Ravinder.
Okay, Ravinder, I'm sorry I missed you.
That's all right.
Can we go, can you give us a vote on the March minutes?
Yes, I approve them.
Okay, and the April minutes?
I approve them also.
And the May minutes?
I approve them also.
Okay, great, thank you. Did I miss anybody else? Okay. All right, financial summary.
Actually, this is the May financial summary. So through the month of May, I've included a very brief narrative. We are awaiting some payments from the state. I've outlined those. The resolution putting funding on the books to the tune of, I think it was 2.3 million for COVID sampling, did pass the legislature last week before. So that should reflect in the June or July report. I don't really have anything else to add. We are busy working on the 2023 budget proposal, and we'll have a description for you at the next meeting.
Okay, great. Thank you, Brenda. Any questions for Brenda on financials?
I could just jump in, Christina. So our budget is due to the county administrator on July 1st. So we're always in this kind of awkward place with the Board of Health that has a late June board meeting. But there are no policy changes related to the budget. Much of what we're doing is maintenance of effort and using the additional state aid that we're receiving moving forward to support some of the positions that were added last year with one-time funding, such as the water sanitarian, the community health workers, and such. So just wanted you all to know that there aren't any significant policy changes impacted by the budget. And we will provide you with the draft budget for your next meeting. So you'll be able to see what we submitted to the county administrator.
Okay, great. Thanks. Sue?
I was just wondering if COVID testing, the PCR testing, is going to be free for symptomatic people forever?
That's a loaded question, Sue. That forever part kind of threw. At the mall, the legislature has allowed us to continue to pay for county residents to get tested at the mall. Those county residents that don't have insurance or are getting tested for a reason that insurance won't pay for through the end of the year, essentially, because we believe starting July 1st, FEMA is only going to reimburse 90% versus the 100% that they have been. So the legislature has authorized up to $200,000 to support that 10%, which based on our current testing would carry us through the end of this year. As far as testing everyone, the uninsured, for example, there was federal funding that was directly paying for that. Because the federal government has not approved further COVID funding, that has been a challenge for some time for CHS for several months now. So they are using their normal charitable mechanisms for paying for those individuals, and the county is supplementing for the others that are non-medically necessary, meaning they're not symptomatic or they're not a close exposure. So the short answer is nothing should change through the end of this year. Beyond that, it's hard to know exactly what it's going to look like. I imagine at some point there will be a scaling back to only pay for testing that is medically necessary. But when that actually happens, we're still looking to see what happens, particularly in the fall.
Thanks, Frank. Any follow-up questions? Okay, let's go ahead to reports then, Frank, since can you just keep the floor and start with your administrative report?
Sure, I submitted a report. I don't really have anything else to add at this point, but I'm happy to answer any questions.
Okay. Any questions for Frank on the administrative report in the packet? Okay. Health promotion. Ted.
Hi, yes, hi, everybody. We have nothing to add, except I just want to emphasize we did have in the packet a picture of this poster that we're doing. We're doing a community health survey. We did one back in March of 2019 ahead of the community health assessment and community health improvement plan, which are state required documents. We're running a little late with getting this out, but we are getting it out. And we would appreciate all efforts to get it circulated and get people to take the survey. We're going to be putting it up on social media, working in cooperation with Cuga Health. We're also going to be going out to some appropriate lists, also county email lists, and some handing out the flyers and posters and so forth. So we're going to do our best to really cover the area. In 2019, we got over 1,000 eligible surveys where everything was answered properly, or all the boxes were ticked as far as eligibility. And we're hoping to beat that this year. The community health assessment and community health improvement plan are both due at the end of this year. We've had fabulous cooperation from a number of partners, including Cuga Health and other partners that we work with commonly. The survey is about 10 minutes long, we hope. I guess I'll just mention that among the questions is, there are 2 questions that we stole from Onondaga County survey regarding COVID. One of them says, for each of the topic areas below, please note how your life is now compared to your life before COVID pandemic. And it's, it got worse, stayed the same, got better, does not apply. And then things like ability to get childcare, emergency health care, ability to get essential items, groceries, and so forth. So that's one. And then the other is, when it comes to COVID-19, what are you most concerned about moving forward? And the options are access to COVID-19, access to COVID testing, treatments, learning gaps in children, and so forth and so on. So welcome to take any questions, but just wanted to point that out.
So how can Board of Health members help you? I mean, we all, are representatives of different institutions in addition, or sectors of the county. So how can we help you with this? Is it best for us to wait till you put out social media and maybe pick that up and sort of recirculate it? Do you have, in addition to this flyer, is there anything, that we can send around to folks that we work with? Like how can we help you best?
Well, we will have a press release coming out soon, and we can, I guess, if it's appropriate, circulate that to Board of Health members. Also, we can circulate PDF of the flyer, which has a QR code on it. And there will be social media. I can be happy to provide the intro text for social media, condensed text that we're going to have, which will basically probably come from the press release. And if it's appropriate, I can, ask that all those items be forwarded to you, or we will make them probably definitely available on the website. So a link to that would be available too.
Well, I think that would be great. So unless
Okay.
there's a problem on your end with sharing that with Board of Health members, and then
Delighted to.
Yeah, because to me, this is part of the role of the Board of Health, and being
Great.
on Board of Health is to help with distributing this kinds of information. Now, I mean, to Ted's point, I think you need to think about your institution or who you're representing and whether it's appropriate for you to use channels, within those institutions. But if you can, then if we can help support, I think that would be wonderful. And then I think the second point I would make is just that we're all personal community members, right? Which is that even if you can't do it through the institution, if you can help with spreading the word through your own personal networks about the importance of kind of helping out with getting this data to the health department, I think that would be great.
There is a requirement of being a Tompkins County resident.
Right.
Sorry, I interrupted.
That's okay. Ed.
That was my question, the target audience, and I assume then that university students are not Tompkins County residents.
I consider a university student Tompkins County residents if they're living here.
Oh, okay.
I mean, to me, Tompkins County residents are anybody who's here on April 1st and the census is taken. And so that would include university students, everybody who's part of the community. That's the survey is primarily trying to find holes, trying to find unmet needs where we can put efforts in our community health improvement plan. And there is a question which asks, what is your idea of a health community? Check up to 3 and a variety of things. This was one we also ran 2019. But yes, everybody who has a Tompkins County address is a member of the community, and certainly would welcome input.
And Ted, you might have said this and I just missed it, was what's the due date? What's the last date people can fill out the survey?
Well, we have, to be honest, we actually haven't determined that exactly.
Okay,
The press release right now says it will be available into July. My sense is that when you get the information, you need to take the survey, otherwise you're going to forget. So as long as we're putting information out, we'll be doing the survey. And I doubt we'll close it before the end of July, but trying to get it done towards the end of July.
okay, great. All right, thank you so much.
Okay, thank you.
Yes, any other questions for Ted before we move on? Comments? Okay, Dr. Claypack.
Thank you, Christine. Hi, everybody. My video on my screen is black. I don't know if you can see me or not.
We cannot.
It's something wrong with my computer.
Okay.
So,
We can hear you fine, so.
well, that's good. That's the only thing that's important. Yeah. So a couple of things. The latest on monkeypox is that yesterday a case of a adult was reported from Chemung County. Prior to this, the only other cases outside of New York City proper were limited to 3 cases, all in downstate counties. So this is the first case that I know of an upstate county. Not surprising. Everyone has been expecting that cases would show up. It's still, in that particular case, I don't know the details in specific, except to know that it apparently is a male and apparently someone who traveled. Unclear exactly where they traveled. It wasn't reported in what I saw. The important thing also is that this continues to be a relatively rare disease. Heretofore, it wasn't really that prevalent out of Africa, as you have read. And it really wasn't much of an issue for a lot of transmission in our country and other European countries. There are 2 varieties of monkeypox. Fortunately, the one that's being detected in the United States is the one that has the lower fatality rate, something akin to 1% or less. So that's also a good thing. And it generally causes symptoms and has a couple of features that are relatively speaking characteristic of it, although many of its symptoms can be confused, are not, I shouldn't say confused, many of its symptoms are non-diagnostic, and so it needs to be considered in a broader diagnostic list of possibilities for practitioners as they do their testing. And it also needs to be included when people are doing STD testing, if the situation fits. The 2 characteristics that are relatively helpful in making you more suspicious of monkeypox are its proclivity to cause lymphadenopathy or swelling of the lymph glands of the body. And the second is the rash that it causes. It's a pox virus. It's related to, in the broader family of other pox viruses, the most notable is smallpox. And this case in Chemung County is unclear as to whether it falls into the category of being treated. Treatment falls into 2 categories. One is pre-exposure prevention, that those target groups are limited. A notable group is healthcare workers who may be coming in contact to monkeypox cases. They can be prophylactically treated. In the category of individuals who have been infected and are diagnosed, those people at high risk of severe disease fall into a category for treatment. Fortunately, most monkeypox is not severe, although it is very annoying. You wouldn't want to get it. But as I mentioned, death is, with this particular variation, is relatively low. The general public should take comfort in the fact that its communicability is far different from coronavirus. Monkeypox can be spread by a respiratory route, but it's large droplet spread. Large droplet spread means that you have to be much closer to an individual who's coughing and spreading the virus than, for example, for coronavirus. In addition, it generally otherwise requires intimate contact for spread. The rash is at certain stages contagious with the virus. Skin-to-skin contact is often required, and that has led to questions about its whether it can be sexually spread. Although the virus has been found in semen and I believe in vaginal secretions, it's not clear that it is a sexually transmitted disease. It may be more that people who have intimate relations are having the type of contact that can spread the virus. The predominant group in New York State that has been infected is unfortunately men who have sex with men. And they account for the vast majority of cases that have been diagnosed in the city. So particular attention and education is needed in order that these people and individuals who may be in contact with someone with this pox virus can be on the alert for symptoms and present to their practitioner at an early stage for a definitive diagnosis and exclusion of other diagnoses that are important to exclude. COVID being one of them, but also since the predominant group that has experienced this virus is also one that may be prone to sexually transmitted diseases, screening for other conditions at the same time that you're trying to clarify whether an individual has monkeypox virus. So that's the message that we need to have going out to the population. Yesterday, when WHCU interviewed me, they were particularly interested in whether I had some comforting words for the general public. And indeed, there are comforting words. The New York State DOH website on monkeypox does clarify who should be alert and what they should be looking for. Certainly this doesn't have the implications, I think, that we have seen for coronavirus. However, how much of it we're going to see in our region is anyone's guess. So that's where we sit. I think the DOH has done a good job reaching out to practitioners along with the CDC to make them familiar with the criteria. There have been very helpful webinars given on the subject. So I think with regard to reaching out to the professional sector, that's gone very well. And what we need to do is to make sure that the general public are also on board. With regard to coronavirus, looking at where we are this year and comparing it to where we were 1 year ago, we see a similar dip in cases, confounded somewhat by the challenge we have in having accurate data. But our numbers, even with that challenge of having accurate data, aren't as low as they were 1 year ago, where we were seeing 3 cases a day and other such remarkable numbers. And it also stands a bit in contrast to the PCR positivity rate of about 4.5% that has dipped down from its high, which was in about the 7% range, gratifyingly so. but it hasn't dropped down to where it was a year ago. And so we're at a relatively better place than we were 6 weeks ago, 4 weeks ago. We do have other variants, which are slowly upticking at this point. And what they will do, only past performance can give us caution, although past performance is no guarantee of future results, as they say. I think as we go forward, we should expect that we're going to see a ramping up of other variants. We're going to see some more roller coaster. We're going to see some new vaccines. And I feel quite confident that in the coming 6 months to 9 months, that second and third generation vaccines will be making an appearance, and we'll be further modifying what we're doing in that regard. And hopefully even better medications. So we've been well served by what has happened so far, because as you know, and as the data shows, the severity has really been markedly affected by vaccination and by medication. For those parents who are considering vaccinating their under 5-year-old child or getting that 5 to 11-year-old vaccinated, it's important for them to realize they now have choices. There are 2 vaccines that are available to be chosen between, and that can only be a good thing. They should still consider vaccination because unvaccinated children are twice as likely to end up in hospital. And that includes the under 5-year-old age group as well. We've had more than 12,000 hospitalizations in children since December. And in the under 5-year-old age group, during this pandemic, we've had at least 400 deaths nationwide. We vaccinate children for conditions that are a lot less deadly than coronavirus. We vaccinate children routinely for conditions that are a lot less deadly than coronavirus. And so I think every parent should think carefully about having their child get the benefit of the vaccines that have now been approved for usage by the FDA and the CDC, and by all major public health and professional primary care bodies in the country. So thank you very much, Christina. And if there are any questions, I'm glad to answer them.
Thank you so much for that thorough update on everything. So I think 2 major updates, one related to monkeypox, one related to coronavirus. So are there any questions from board members or follow-up from board members on those topics? So I had a quick question, actually, directed probably at Ed, but also Dr. Claypack. Is I was curious whether Cornell is doing any sort, if you've had any angst at all from your students about this, or if you're doing any proactive outreach to students to help explain kind of what this is, and or we're just not at that point yet.
Yeah, I don't think we're at that point yet at Cornell. I mean, this has been very limited, and as Bill was saying, that it's been fairly limited to just to kind of New York City area and not that many cases. Obviously, now that we have a case closer here, it may start to kind of pique our interest. Needless to say, we have prepped ourselves with our clinical providers and to make sure that everybody's aware and that we have we have protocols in place to kind of how to reach out to the health department and how to treat and all that. So, but other than that, other than instructing our own staff, we have not reached out to the community as far as I'm aware of.
Okay, that's great. I just kind of wanted to see where you all were with your student populations. And then I also just wanted to point out to everybody, if you're not watching the chat, that Rachel put a link in the chat for everyone if you need more information, where you can find it for the New York State Department of Health. Okay, Yeah.
I could just add quick, Christina, we have been fielding some emails from Planned Parenthood. I think they might be sort of the local agency that sees, the first case. Not that I want there to be any cases. But Dr. Claypack and I have been communicating with them about testing, specimen collection, sort of the details on that when it comes to be. And we've been getting some community inquiries too. We got a phone call yesterday of someone interested in pre-exposure vaccine, which, that New York City had one vaccine clinic that ran out very quickly. So we couldn't, all we could say was there's no vaccine locally. New York City had some and no longer has any. And just, stay tuned.
My understanding is it's very hard to come by the vaccine at this point.
Yes.
And we've done some research on that already. Yeah.
Yeah, it's federally limited, I think. It's at the federal level.
The other venue that I discussed monkeypox and its implications and so on is the Southern Tier AIDS program. And we discussed that, as well as I directly discussed the 2 cases of congenital syphilis that we have experienced in the region, and the need for them, if they have any pregnant clients in the STAP client network, to be aware of the repeat testing that's required for those pregnant individuals, and to consider monkeypox and syphilis and other, when they're considering the other STDs they're looking for.
And in terms of diagnosing monkeypox, the testing that's done, is that a test that we can do locally to confirm, or does that have to be sent to Wadsworth for confirmation?
That has to be sent to Wadsworth.
Okay.
It's a 2-step process, interestingly enough.
Okay.
The first step of the process is to test for whether the infection is a pox virus.
Okay.
If it is a pox virus, because of the rarity of other pox viri, it's presumed to be monkeypox, but it's not considered a confirmed case. And that specimen would be referred on to the CDC, who would then do the definitive testing, if indicated, to test directly for monkeypox.
Okay. Thank you. Thank you, Health Department. Just when you thought you were going to get a breather, right?
And one more quick thing I just would mention is that Jen Meredith convened a panel on monkeypox last Friday. Probably some of you were aware of that. That was just informational and had some good panelists on there to talk about the disease.
Great. Okay, thanks everyone. Anything else on this? Or I will move on to Claire. Okay, Claire.
Morning. Nothing to add from the CHS report this month. We're very busy restarting our normal CHS services and programs. One thing I did want to ask the Board of Health members is to help us recruit. We have 2 community health worker positions and a community health worker supervisor. We're going to be working on the PITCH program, which is focused on perinatal and infant community health collaborative. If you could please circulate and promote this opportunity for qualified candidates, that would be great. I'm just dropping the link to those 2 positions here. And then I did invite Michelle Hall here to answer any questions about WIC. Rachel, who's already responded, some is also available for questions on communicable disease. So thanks.
Okay, thank you, Claire. Any questions on WIC or anything else? I can't remember where in the board report the formula thing was, where it was like, this is the pictures. I thought that was really helpful. So if folks didn't, I can't remember whose report it was in, but if folks didn't see that, because I know we did talk about formula last time we were together. So I don't know if that's eased in the community or if you're working with populations. There was a really nice graphic in there if you need it.
It can also be found on our Facebook page.
Okay.
So we continue to update the photograph. What I did include it. The New York State created a and vendor created a picture tool shopping guide for families in the community. It really sections formulas that are available in categories. So milk-based formulas, soy-based formulas, and hypoallergenic, so that if a family member is shopping, they can look at alternative formulas in those subcategories. Just to ensure with pictures of the different brands and also can sizes, so that just to ease shopping for people, and so that they're purchasing the same type of formula and they're not having to call. So that was the reference. We do post it each time it's updated on our Facebook page, and we are giving it out to our families.
Great. I thought that was a really nice resource. Yeah, Sue.
I just wondered that for the most part, are people able to find the formula that they need? It just takes more effort, or where is the status of the shortage?
We are seeing a slight improvement on some powdered formulas on the shelf. We are still seeing some of those hypoallergenic like Nutramigen, Elecare, some of those specialty formulas, but the formula companies for those preemie babies in the NICU, there is like a direct link that the doctors can submit a form, to try to help families. We are receiving we're working with our vendor agency. If a family is not finding like Nutramigen or one of those specialty formulas, we're receiving like a drop shipment directly for families. So we are seeing some improvement. I will say that the number and volume of necessity has decreased in the last month. So I wouldn't say it's over, but it is getting better.
Great. Thanks, Michelle. And thanks for the work on this as well. Okay, any other questions on this or comments? Okay, great. Thank you for joining us. All right, let's move on to Deb with Deb with special healthcare needs. Everyone's things are shifting on me. Your square shift, and I'm looking at people and they shift. Children with special healthcare needs.
Hi, everyone. Nothing new to add to my report today.
Okay, thanks, Deb. Any questions for Deb on the report? Okay, our county attorney is here today. Bill? They're talking to you.
Sorry.
Do you have anything?
I wasn't feeling well last night.
Do you have anything to add?
No, I do not.
Okay, thank you. I'm going to go ahead and move on to Liz. If you've got anything to add to your report.
I don't have anything to add to my report, but I would like to introduce Dylan Schultz. He's an environmental health specialist, and he is on listening in to today's meeting because of all the vaping related enforcements in case I need assistance.
Okay, great. Hi, Dylan. Welcome to the meeting.
Hi there. Thanks for having me.
Yes, you're about to take center stage here if this is all your enforcement action. Okay, any questions for Liz on her report? Okay, and then I don't think I see Harmony. I'm sorry, there's lots of you, but Frank, I wasn't sure if there was something for CSV.
Yeah, no, Harmony's actually on vacation
Okay.
Right now, and I don't have anything from the CSP.
Okay, great. Okay. All right, so I think we're going to move on to our environmental health actions. We have quite a few of them. I think the first 5 or 6 are related to the flavored vaping products. And then we have one was related to the pool, and then grassroots and water, and then the Tosa apartments. So hold on, let me get down to the right place in the packet so that I'm speaking appropriately about what we have.
I was wondering if the board could take one initial action that would address all resolutions that are adopted today. The penalty deadline in each of these resolutions needs to be changed to August 15th. There might be some that are actually have it as August 15th, but for the older, most of them, the penalty deadline needs to be changed to August 15th. And is it possible for the board to just adopt that all at once so we don't have to remember to say it for each action?
Can I do that, Frank, or do I need to do it for every action?
No, I think you can do it. We'll just make it an administrative action that's recorded in the minutes that we need to change the date to the 15th of August on each of the resolutions.
Okay, and Liz, does that apply to every resolution that's on that you have on there, or only certain ones?
TOSA probably is up to date. I know Finger Lakes was older.
Okay.
So TOSA should already be August 15th. Yep, it is.
Okay, and so maybe the statement in the minutes then is that, and then Frank, do I need the board members to vote on that? That's okay, or we can just make that statement?
No, I think we can just submit it as an administrative action for
Okay.
each to update all those resolutions to August 15th. And then just when you're voting on each one, know that you're voting on it with an August 15th due date.
Okay. Any concern from board members about that before I go ahead? Okay. So we'll stipulate that all due dates are being changed to August 15th if they're not already at that date. Okay.
Thank you.
Yes, you're welcome, Liz. So, yep, go ahead.
So I also, since there are so many resolutions today, there are several, all of the vaping ones, number 1, number 3, except number 2, number 1, number 3, number 4, number 5, and number 6, which are Cayuga Smoke Shop, Commons Market, Jason's Grocery and Deli, I'm not sure how to say that, Convenience, and Ithaca Convenience. All of those are have a proposed penalty of $600, and they're for the sale of either having flavored, banned flavored vape products for sale. So I just thought I'd mention that in case the board wanted to consider those all together, or whether you would like to address them individually. Number 2 is different, but Dream Vape, but the other ones are all pretty much the same situation.
So I guess I'm assuming we have to address them individually, but both Shauna and Ed have their hands up. So Ed, I think I saw yours go up first.
Yeah, I guess, does this mean that is this like a first time offense? Is this a repeat? This $600 is.
So to kind of provide some refresh memories, which I needed mine refreshed, this whole, the flavored vape ban came about right as COVID was hitting, right? It took effect in 2020. So we were pretty much handling things on a complaint basis. We got information out in 2021. We are now doing inspections at these facilities. So these are kind of first time offenses for these specific facilities. And the penalty, this is consistent with the ones that came before you a while ago, I think it was. So there's for first time flavored vape sales, we're doing $600, $350, I think, plus a $250 surcharge. I think how it's actually presented in the resolutions.
Okay.
So we do, I think we should be consistent with them, and these are all consistent.
Okay, Shauna.
Yeah, thanks for the background, Liz. I personally would, I am fine with being consistent so that the fees that we vote on today match the ones historically. However, I was wondering if there is a second situation, if we could really make sure that we increase the fines. My fear is that these flavor jewels are really preying on our children, and $600 in the grand scheme of things really isn't that much money considering how much they're charging. And I understand, typically fines are to discourage this behavior. But I think we all know that $600 is probably how much they're making in a single day of selling these flavored jewels. So can you talk to what it would look like if there's a second offense?
Well, if you look at Dream Vape Resolution number 2, that has a proposed penalty of $2,500. So they actually had an underage sale involved in that, but the fine is significantly higher in Resolution 22008 for Dream Vape, the second one on your agenda.
Thank you. And thank you and your staff for doing this. This has been a situation that's been percolating. I know that I reached out a few months ago. My daughter's middle school, DeWitt, there were kids that were selling these flavored pens in the bathrooms. And I know in the high school as well, it's become quite an issue.
Okay. Okay, any other general questions before I start to proceed with voting on these things? Okay, so what I'm understanding is that we're going to vote on resolution number 1. If everyone has their agenda open so that you know what we're doing. Resolution number 1, which is Cuga Smoke Shop. Resolution number 3, which is Commons Market. Resolution number 4, which is Jason's Grocery and Deli. Resolution number 5, which is Ira Convenience, and then resolution number 6, which is Ithaca Convenience as a group, because these are all first-time offenses with the same penalties being applied. Okay. Is there any objection that I need to be aware of before I ask for motions on this? Okay. So then I'm looking for a motion to approve those as written. I have a first from Shauna, a second from David. Any discussion needed on these? Okay, all in favor of approval as written? Okay, Melissa's a yes. And then is there anyone else I can't see? I can't remember if there was someone else I couldn't see. Oh no, I can see everybody now. Okay, so I think that's unanimous. Any opposition that I missed just because there's lots of folks and abstentions? Okay, so that's good. So then let's go to resolution number 2 now, which is the same topic. It's just a second offense or third offense. I can't remember what it was. It's a higher fee. So approve a motion to approve as written. Okay, first from David, a second from Ravinder. Any discussion? Liz, you came off mute. Is there something you'd like to add on this one?
No, I just say that they did have 2 sales of flavored vape nicotine products. In this one was to someone over 21, probably Dylan, and the other one was to an underage, to a minor or someone under 21. And then they also had flavored vape products for sale on both dates, March 4th and March 16th, and no signage present. So the proposed penalty is $2,500.
Any questions or discussion on this one? Okay, all in favor is written. I believe that's unanimous. Okay. All right, moving on to number 7, which is the Hilton Gardens Seneca Place, their spa pool. So can I have a motion to approve as written? First from Ed, second from David. Liz, is there anything additional that we need to hear about or any questions from the board?
On this one, oh shoot, I did forget something on one of them. On Hilton Garden Inn, they were insufficient disinfection on 2 dates. And then they have changed their disinfection and with our approval, and they've had no additional violations since those corrections were made and the pool is now open. So they're in compliance with the actions in the order.
Okay, aside from the payment of the fee.
It's beside the penalty, yes.
Right. Okay, any other questions on this, comments? Okay, all in favor is written. I'm sorry, everyone's supporting that? Yes. I think that's Melissa. Yeah. I think we're unanimous again.
And Actually, I'm sorry. I did forget one thing on one of these. I apologize. For Ira Convenience Store, the facility operator did request that the board consider a reduced fine via telephone. Because the cashier said that the facility had been recently purchased and was numbered under new ownership, and the inventory was purchased prior to it was there before, right, when they did the store. But and the board can reduce the minimum, can reduce the penalty. There's not a minimum for the flavored vape sales. It wasn't a lot of product, but some of the other stores didn't have a lot of product either.
Okay, so
it felt
this
like
is
it was being
for,
consistent.
okay, this is, okay, so let me, let's figure out how to do this. Okay, that's okay. So for resolution number 5, there was a request, that was made verbally to reduce the fine. So they didn't come to the Board of Health. They made the request to you.
Well, not to me, to Skip. That's why I forgot.
Okay. And so, Frank, can you just help me with process here? Do I need to ask for a motion if anyone wants to open this for discussion?
Yeah, I think since you've passed the resolution at this point, someone would need to make a motion to reconsider if they wanted to consider reducing the fine.
So does anyone want to make a motion to reconsider the fine that was applied to number 5? Okay. So the request is denied, Liz.
Thank you.
Yep.
Sorry for the
That's okay. Okay, so number 8, which is Grassroots Festival, and again, this is related to the water system. So if we can open this with a motion to approve as written. The first from David, a second from Shauna. Okay, any discussion or commentary from you, Liz, that's needed on this, or questions from board members?
So this one, we did continue to have issues with the on-site water plans. They did not submit approvable plans by the deadline in this draft resolution. However, we did issue public health director's orders subsequent to that, and we'll be bringing additional enforcement to the board with respect to this and any other violations that come up during the festival, after the festival is over. However, there was one issue was they weren't submitting plans, and the other issue was when they did submit plans, they were going to install a permanent system at the fairgrounds, and they wanted to install a shallower water system that was not below the frost line, and the fairgrounds said it needed to be below the frost line. So we've recently agreed that they'll put in a temporary system that we have approved plans for the festival itself, and install a permanent system by October. So water plans were just approved this week, I guess is the bottom line, but it was a difficult situation getting there.
Okay, so questions from board member. I mean, I'm losing track at this point because I feel like we've had this conversation 1,000 times with them about water. So I'm sort of losing track of where we are with them on this. But are there any other questions from board members? Yes, Sue.
So just to clarify that the fine is for missing deadlines and not producing adequate plans by the approved deadlines. But at this point, they do have workable plans for the July 22 festival.
Yes, so the $500 proposed penalty is for violation of resolution 220016 that required them to submit approvable water plans by February 21st, I think was the deadline. Okay, and we now have approvable water plans as of this week. Right?
Yes, and we would have taken action on this in our last meeting, right? But we didn't have quorum, so that's why it feels a little behind.
It might have been 2 meetings ago.
Yeah,
right?
2 meetings ago, actually, you're right.
This was on.
And it's important to recognize that these deadlines were put in place because this is complex work. And our staff are scrambling at the last minute to try to get them into a place where we can approve a permit. As it is, they have approvable plans. They still have to install it, right? And we're less than a month away from the event starting. So I just want to be clear that we're asking for these things in a timely manner, not only for our benefit, but to make sure that they can adequately complete what is necessary to provide a safe and healthy environment for the event goers. So the timing may seem a little weird with the plans being in now, but it has created extra work and scrambling on our part, and quite frankly, added concern about their ability to get it completed before the park, before the event starts.
But on a positive note, we do have approvable plans now.
I just can't, so, okay. Any other discussion needed on this? Yes, Bill.
One concern I have is they seem to be doing things right up to the final minutes of a deadline. Don't you want this fixed and done 7 to 10 days before the opening event? So that your crew is not running around with their heads cut off?
So that was what we did, Bill, in the enforcement we took in 2021, right? It made them submit, that's where we made them submit their water plans in February. They had to submit a complete mass gathering application by June, right? They didn't exactly, they certainly didn't make the water deadline. And, you know, there was still haven't completely met the other deadline, but we are in better shape than we were in previous years where we were going through this the day before the festival, before we were supposed to issue the permit. So yes, our goal is to do what you said. It's a challenge getting that implemented, but there have been improvements this year in the timing. We're having these discussions now with weeks before the festival.
Okay, any other comments or questions? Okay, so let's go ahead to vote. We're voting to approve, all those in favor of approving as written. Okay, I think we're unanimous again. I didn't miss anybody, did I? Great. All right, moving on to our last one, which is TOSA Apartments and their water treatment system. Can I get a motion to approve as written? First from David, a second from Ravinder. Liz, is there anything else to add to this or questions from the board?
I'll kind of just summarize. I'm not sure what board members were, since there are some new board members, this is a violation of Board of Health orders. We've had difficulty in the past with TOSA and their water system and communication and responsiveness from TOSA. And that was going better for a while. And now those problems are resurfacing where we're having insufficient chlorine and we're not getting response from them on the boil water order. So they also didn't submit their total coliform sample results for the first quarter. So we're kind of revisiting again what you guys saw back in 2020, those of you who were present. So it's a challenge.
Any questions from board members? Okay. Let's go ahead and vote. All in favor of the motion to approve as written. And we have Melissa too, so we are unanimous. Okay. All right, everybody. Thank you for the votes on that. I think I covered everything. I didn't miss anything, did I? I don't think so. I think we're good. Okay, so Liz, you're still up. For the review of our environmental health division fees, which for board members is included in your packet and typically includes in red the changes that the department is proposing. Is that correct still, Liz?
Yes,
Okay.
and these are for you're essentially for discussion because they are adopted as part of the budget. So.
Okay, so this is not, we're not voting on these, we're just discussing them.
Yes, but if you, I mean, if you wanted any changes, they would need to be made right away because the budget is due the end of July.
Okay, can you talk, since we do have new board members, can you talk quickly just through the changes that you're proposing and why?
So our environmental health fees cover a percentage of the cost of the work we do at regulated facilities. And one of the spreadsheets actually shows what percentage cost we're recovering or expected to recover. It's in table 2. And for-profit facilities, we tend to recover a higher percentage. And then for things that are life's necessities like water and sewage, we tend to have a lower cost recovery on that. And so because of the pandemic and issues, with our operation as well as with our facilities, we're not proposing any changes this year except for 3 minor ones. We've started seeing some vending machines regulated vending machines, not like potato chips, but like pizza or whatever, that type of thing. And so we are proposing a vending machine permit fee of $85. That's the same as what we currently charge for food services that operate a mobile cart, a food truck or something like that. And we also are proposing to increase the mass gathering operating permit fee for existing events, which is essentially for grassroots, from $2,000 to $3,100. We're getting golf carts, which we think will helpfully streamline our whole inspection process and the time we spend conducting inspections. And we're covering that cost, intend to cover that cost through the operating permit. And then the last thing is we have started issuing some permits for enhanced treatment units for on-site wastewater treatment systems. And those need an operating permit because they require regular maintenance and servicing. And so we're proposing a permit renewal fee of $50, which is the same as a holding tank, to cover, help cover our costs in that area.
Great, Liz. Thank you so much for that background and update. So any questions from board members on this? Yes, Sue.
Yeah, I'm just curious, does a vending machine need approval? Is that based on temperature? If food needs to be either kept hot or cold? And why are some regulated and others not?
Well, like potato chips are stable, right? They don't pose a risk, right? Until you open the package and eat them. And then who knows what health risk you're ingesting, but the actual sale of them isn't a problem. But if you're selling, like they can sell pizzas, they can sell chicken fingers, there's other things that are kept hot in a vending machine that you then can get. Those are the types of things that are regulated.
Other questions?
I believe it's Ithaca College. I know Ithaca College has put in a couple of those. I think that's the only facility that has started doing that, partly because of, staffing issues and stuff.
Okay, other questions? Okay, great, Liz. Thank you so much. Okay, the next one, the video observed therapy. Frank, this one I think we did have to vote on, correct? Okay.
Correct, yes.
And Claire, this was your item, I believe?
Correct, yes.
Okay, I just want to make sure I'm talking to the right people.
Yes, and Rachel here as well. She drafted it.
Rachel
so
too, right. Okay, thank you so much.
Questions.
All right, so let's do it this way. I'm going to ask for a motion to approve the policy as written. A first from Shauna and a second from David. And then Claire and Rachel, if you could just give us a brief background on this for discussion in case board members have questions.
Sure, yeah. I mean, this came about because of COVID. We started doing direct observed therapy by video very quickly, but we realized we needed something formal in writing. Our current patient is very tech savvy and has a smartphone, but we may be encountering elderly people that struggle with technology in the home. So we wanted to get down in writing all the steps to set it up, consent form for the patient. I consulted with Dr. K and our TB consultant, Dr. McQueen, and some CDC resources just to formalize it and make it, something we could refer to. That's really it.
Great. Thanks, Rachel. So any questions from board members? Comments? Okay, let's go ahead and vote then to approve. Everyone in favor of approving is written. Got Ravinder. Do I have Melissa? Yes, so that is unanimous. Okay, thanks everybody on that. Okay, voting is done. Thank you. We have two just last items to do. Frank, if you could do the merger update, and then I just need to talk about the next meeting really quick as well, the July meeting, when you're done.
Thanks. Yeah, so our regular merger update for this month, work is continuing along. The Jeremy and Brenda are working diligently on getting both budgets together. The chart of accounts really is going to stay the same. We're just going to move under a single department. That hasn't happened in the county system yet because there's still some work they have to do on their end, but they tell us that it is possible and will happen before we're in front of the legislature. There's a lot of work going on around getting to know each other. Actually, tomorrow both buildings will be closed and we're having an all staff meeting together for the whole day. We've got a lot of events. It'll be an outdoor event. We'll be providing lunch for the team and really just focusing on getting to know each other. That we did have a cross-functional team that worked on a network analysis of our connections. And so we've used that information to kind of put people into small working groups, different working groups throughout the day. There's just going to be some activities going on where we're going to encourage folks to, work with people that they might not know. So we're really going to spend a good bit. We're going to spend the day getting to know each other because I think one of the things we're finding is that as we're beginning to talk about the integration of services, it's hard to really have strong conversations when we don't know each other and what we're doing. So there's going to be a lot of that going on tomorrow. We're working on an internal directory that'll be online for folks, so they'll be able to look each other up and see what they do and what programs they work in. So a lot of different activities happening around us becoming, a single department and knowing more about what each other does in hopes of informing our ability to integrate. Further, we are still looking at co-location of services, both some mental health services up here at Brown Road and some public health services downtown at Green Street. So hopefully within the next few months, some of those things will be getting launched as well. And then probably the biggest, most recent news is the branding group has been working through its process and has selected a name. And so this board, the Community Services Board, as well as all staff, received an email from me kind of outlining the process that we went through and sharing the name that the group came up with. And for those that may not have seen, it is Tompkins County Whole Health. We went through a pretty extensive process. We brought a consultant on board to help us come up with the name. We reviewed hundreds of proposed names that were narrowed down for us. And then we had conversations. We sent some feedback back. They came up with some additional options for us to look at. There was a lot of factors to consider. First, we wanted a name that we thought was going to, tell the community what it is we do and who we are. What we wanted to make sure was Tompkins County was included because we felt that was really important. Another consideration is while the name isn't Tompkins County Whole Health Department, you certainly could put department after it because we are part of the county structure and it kind of still flows in that way as well. So it helps meet that need. And I think, while I don't think any name was going to make every single person happy. and I have received both positive and some feedback, you know, with I don't know, concern or different interest. But I think the process we went through was a strong one. And I'm hopeful that you all feel like it is something that you can support. We're not asking for a formal vote at this point, but we do have more work to do with the consultant, which will include creating a logo and some additional branding materials. So before we went to that, we wanted to, you know, get some initial reactions to the new name that we came up with. Christina, I don't know if you wanted to add anything to that before I, you know, see if anyone has any.
No, I think that was great. I mean, there was lots and lots of proposals for names. So I think it was a good process. So did anyone have any questions or comments for Frank? Yes, Sue.
I'm just curious as to how many staff people there are in the new whole health department. How many people will be at the event tomorrow?
I think we have 127 total.
Great. Other questions? Comments?
Okay, well, if there is none, I did get some email feedback from folks and I do appreciate that. The Community Services Board, I think, is July 10th because of the July 4th holiday. So we'll be talking about it with them as well. But assuming things go okay there, we will, you know, we'll continue work moving forward with the consultant to do the additional branding work. And then ultimately, all of this will kind of come to you, I think, in one package in preparation for the charter process. So it will include bylaws, it'll include the name and logo, and the proposed charter language for your final review and vote. And to the bylaws conversation, Christina, I need to talk with you about that later this week. I think we're at a point now where we can be looking at both of them and trying to figure out where the overlaps are and how we can create some consistency and hopefully bring those to the boards in their next cycles through.
Yeah, and I wanted to, I mean, I know I've been promising the board, you're going to see these for like 3 meetings, and we just haven't gotten to the point where there's enough consistent language for it to make sense. So I think we're hopefully almost there. So you will see it eventually here. Okay. And I guess I would just say if there's anybody who has concerns about the name or wants to raise issues that wasn't comfortable saying it publicly, that you should feel free to reach out to Frank by email. Okay. All right. Anything else on this? Okay, thanks, Frank. So the last thing I wanted to just touch on was the July meeting. So I cannot be at the July meeting because I am on vacation, but it's not just because I'm on vacation. I'm actually in transit on that day on the exact time that the Board of Health meeting is occurring. So I don't have any way of being able to connect. So David, I think that technically you're the next person that would run the meeting. So I just wanted to check and see, are you at the July meeting? And if not, then I think we go to Sue next, maybe. I can't remember what the right order is. So I think I just wanted to check with the board members and just say somebody is going to have to run the meeting because I won't be here. So you're on mute, David.
What's the date again?
I think it's July 26th. Does that sound right?
July 26th is it?
Yeah, July 26th.
So just for a point of information, I also will not be at that meeting because I will be on vacation as well.
You're on mute again, David. You're on mute. We can't hear you. David, I can't hear you. You're on mute.
I'm sorry. I know that we are also camping in July for a week.
Okay.
I will have to check on the date. I think
Okay.
it's just the week before that.
Okay.
So
So can I just check with other board members? Is there anyone who will not be at the July 26th meeting that we need to be aware of? Or everyone else will be here? Okay. All right, so David will check and then we'll follow up with other folks in terms of who will actually run the meeting. Okay. Thanks, everyone. Is there anything else we need to talk about? Otherwise, I think we've achieved our agenda and I'll go ahead and adjourn.
Just real quick, Christina, I just wanted to update folks on the virtual meetings. So being able to meet fully virtually is connected to the governor's executive order of declaring an emergency or whatever it is. It's an executive order. She is renewing those monthly. So on the 14th of each month, it is renewed or it won't be. So we're good now through July 14th, but we'll have to wait to see if it gets extended to know if we'll be able to meet like this in July as well, and each month moving forward. So we'll keep you updated as soon as we know something, but just so everyone's aware, the option that is available to us because the legislature passed a local law is when we can no longer meet fully virtually. Some people can participate virtually, but they do not count towards quorum. So particularly with this group, because it's a smaller group, and we're really going to need folks to try to plan to be in person because otherwise we're going to struggle with a quorum each month. So just thinking about that, I would imagine the summer we're probably going to get those extensions, but really start looking at your calendars for, early fall, September-ish, to start putting travel time in your calendars before and after for us, if you can, and adjusting appropriately, because it's really going to be important for us to have a quorum.
Yeah, David.
So I finally got my calendar, and that week of the 25th, we are away camping.
Okay. Sue, are you around that you're planning to be here? Are you okay with running the meeting? Okay, great. Thank you so much.
And so with knowing we'll have 2 members gone, that means we only have 1 to the positive for a quorum. So if anyone else is not going to be able to make that meeting because of summer plans, please just let us know. Because we'll cancel the meeting rather than having a meeting without quorum if that ends up being the case.
Yeah, Melissa texted and said she had to jump off, but that she is planning to be at the July meeting. So I'll just text her and let her know that if that's going to change, she needs to let you all know as soon as possible. Okay. And then Ed, you had your hand up. Was that your question? Did he address your question?
Frank addressed it with the
Okay.
whether we needed to be in person or not. So yeah.
Okay, great. Okay, anything else from board members? Or anyone else before we go? All right, everyone have a great July, since I won't see you, and then I'll see you again in August. Okay.
Take care. Bye.
Thanks. Bye, everybody. Take care.